right. So we're gonna start with shoulder flexion, and it's important to note, and I'm gonna just turn you towards the camera here. When we're doing any kind of shoulder movement, the scapula is moving as well. So just to show you quickly the movements of the scapula, so you have elevation, so you can see her scapula here, depression, protraction, and retraction. So you can see how her scapula moves. Now, when we move the shoulder, the scapula has to move as well. So we call that the scapulohumeral rhythm. So the scapula is moving, and you can see the inferior angle as she goes, moves like this. Okay, so it's important that those two things are working together. First, we're gonna look at flexion. So the muscles that contribute to shoulder flexion are the anterior deltoid, the coracobrachialis, and the pectoralis major. Normal range of motion is 0 to 180. So when you're measuring this, first of all, you're gonna talk to your client, you're gonna tell them what you're doing and why. And then, I may turn this way now, that we don't need to look, okay? And then what I like to do is see what they have actively. So I will show the patient the movement. So I'll say, I'm Jennifer, I'm your occupational therapist. Today we're gonna look at the movements of your shoulder and measure those today. So when I first see the patient, I wanna see what they can do on their own. So that's your active range of motion. So I'm gonna say, this is the movement that we're doing here. I'm not gonna talk to Courtney and say, do shoulder flexion, because she doesn't know what that means, okay? So can you just point your thumb to the ceiling and go up as high as you can go? Good. So we can see actively that she has greater than half of what's normal, right? So if your patient has greater than half active range of motion, you're gonna measure it, and then you're gonna go straight to manual muscle testing. However, if I say to do this, and Courtney goes to here actively, then I need to see what her range of motion is passively. So I'm gonna support the limb, both proximally and distally, and I'm gonna bring her through range of motion. Now, this is where our formula comes in. If passive range of motion is greater than active range of motion, then we know that there is a strength issue here. Courtney does not have the strength in her muscles to overcome the weight of her arm and gravity, okay? So if I do passive range of motion, and passive range of motion equals active range of motion, so I get here and I'm kind of like, oh, I'm stuck. I can't go any further. Then that means that structurally something is going on here. She may have an old injury, she may have frozen shoulders, she may have severe arthritis, something structurally is happening here, okay? So if passive range of motion is greater than active range of motion, you need to take your patient to gravity eliminated and look at range of motion in the gravity eliminated plane, okay? So that's how you need to think about every movement. Look at active range of motion. If active range of motion is full or greater than half, then you can test their muscle strength. If active range of motion is less than half of what they should have, okay, so full range of motion is 0 to 180. If their active range of motion is less than half, so less than 90, then you're gonna look at passive range of motion. Okay, so that's your next step. If passive range of motion is equal to active, you stop there and you apply your resistance and do your manual muscle test. If passive range of motion is greater than active range of motion, you need to place the patient in gravity eliminated. Okay, so